Good afternoon. My name is David Blackburn. I'm your Bell County Judge. This is a COVID-19 update for Bell County, today, July 9th, 2020. I've got multiple guests with me here today, including Dr. Chadwell, our Director for the Bell County Public Health District, Dr. Robert Greenberg, who is the Director for Emergency Medicine at Baylor Scott & White, Dr. Karen Brust with Baylor Scott & White. She is the Infectious Central Director. And I messed up her title, and I apologize. I'll get that right when she comes back up here. Dr. Ahmad, who is the Chief Medical Officer for Advent Healthcare in Killeen, and then also the Chief Nursing Officer for Seton Medical Center in Harker Heights, Ms. Travis. So I'd like to call on Dr. Chadwell first to come to the podium.
Good afternoon again. So I'm just going to go into the numbers, and I have a little bit of news to share with all of you after that. We did hit a new record for daily cases today. If you've seen the dashboard, you saw that we had 140 new cases today. That puts us at a total of 1,886. And that's still at 13 deaths. We have not added any new deaths, but we did add a number of hospitalizations. And we do have a assisted living outbreak at Indian Oaks. There were 5 cases reported to us yesterday. We did coordinate with the facility to mass test. That is underway, and we'll have new information about that when we receive the lab results for those tests. And I think that's all that I have for you, unless there are questions for me. All right. Think you might be on mute, maybe. Sorry, can't hear you. Not sure.
It looked like Mr. Moore had some questions, but again, we could not hear you on this end. And your mic may have been muted or some other technical issues. At this time, I'd like to ask Dr. Greenberg, who is the Director for Emergency Medicine at Baylor Scott & White, to come forward. I've asked him to address several questions that I've been receiving recently related to hospital capacity and specifically at Baylor Scott & White. And the questions revolve around the number of ICU beds, the number of medical surgical beds, how many does Baylor Scott & White have? Are they full? I've also had questions about exactly what the capacity is for Baylor Scott & White in those 2 areas. And another question has been whether or not elective procedures or surgeries have impacted their operations at the hospital there. So with that, I'd like to call on Dr. Greenberg.
Good afternoon, Bobby Greenberg, Baylor Scott & White. I'm the CMO of Emergency Services for Central Texas. I'm going to give a few updates first and answer a question actually that was sent, and then I'll be happy to answer questions. Regarding capacity, and I'm really just going to talk about our Temple Memorial Hospital, the large hospital. Our total capacity is 550 beds. Our ICU has 70 beds. Currently, we have 16 patients in the ICU that have COVID. 11 of those are on ventilators. On our floors, we have 47 patients that are COVID positive. So the total for that is 63 patients currently hospitalized. And again, our capacity is 550 total beds. Don't get me wrong, we are busy. The place is busy. We're seeing a lot of patients. As of today, we are currently operating everything, all elective surgeries and everything else, but we are monitoring it and closely monitoring it every single day. What has us worried is the 4th of July weekend, because we have not yet seen the impact of the activities of the 4th of July weekend. We are very concerned, based upon reports of lack of physical distancing and people doing some of the things we would really like them to do, that we are going to see a much larger spike in patient volume. So are we worried? Yes. Do we think we can manage it? Yes, we absolutely do. We are actively managing our business. We're making sure that we can take care of the patients that come to the emergency department, and we are taking care of the community at large. One of the questions that was asked was, what can the general public do to help address the concerns regarding our capacity and regarding the spike in cases? Well, the answer to that is to do the things that will decrease the transmission of the disease. So the best way to do it, quite frankly, is physical distancing. If you're not around other people, you won't get the disease. There is and so people would then ask, well, what's the best way to do that? The Texas Medical Association has come out with an easy-to-read risk scale for what's more risky than others, because it's not always very intuitive. Are we able to display that, sir? All right. So this is available to anyone that wants to see it. If you go to the TMA website, texmed.org, and go to the COVID-19 page. And I'll explain a few of these because they're not always completely intuitive, but this is the best way to decrease the transmission of this disease. So things like opening the mail, very low risk. Getting your newspaper, very low risk. Pumping gasoline, very low risk. I was asked why on this list playing golf is above pumping gasoline. It's because when you play golf, you high five when you go in regulation. When you fill up your tank in regulation, you're not high fiving anybody. Sounds kind of funny, but it's true. It's the little stuff that you have to think about where you're in contact with other people that may be infected. And remember, up to 80% of people are asymptomatic or have very mild symptoms. So as you go down this list, what you see in common is that the more people that are participating in an event, or the more people that come and go, absolutely the higher your risk. So I highly recommend that you look at this and that you show it to your friends and family. And the bottom line really is stay at home when possible, wash your hands frequently, avoid large crowds, keep 6 feet apart, and wear face masks or face coverings when around non-family members, or if you can't be 6 feet apart. Did you want me to take questions now? I'll be happy to answer questions. I don't know if he's trying or not. All right.
Thank you, Dr. Greenberg. Dr. Brust is with Baylor Scott & White. She is with the infectious diseases at Baylor Scott & White and is the infection control director there. I think I got it right this time. We're close to it. Questions that I've been receiving that Dr. Brust might be able to address are along the lines of what are the best preventative measures that we can take to mitigate against the spread of the virus? Are face coverings effective as mitigating against the spread of the virus? What is the typical course of treatment for someone who is not hospitalized that has COVID? What is the typical course of treatment for someone who is hospitalized for COVID? We've been hearing there's two types of COVID, respiratory-based or focused COVID and the GI-based or focused COVID. Perhaps she can address that. And then quite a few questions and comments about the data showing that the vast majority of the population will either be asymptomatic or develop only mild symptoms. And perhaps you can address those also. Very welcome, Dr. Brust.
Hi, thank you for having me. So, you know, the medical community's message has not changed at all from the beginning. It's always been physically distance, mask, and then wash your hands. And for me, you know, the biggest thing really is physically distancing. You know, I think of myself as a physician that's on the front line to care of the patient and also kind of front line for preparedness for our hospital. And you know, I was just working on the COVID unit last week, and the stories that I heard patient after patient were very much the same. There were people that were getting together for Father's Day dinners, barbecues, some kind of later held graduation parties. Everybody started kind of with a tickle in their throat, a little sore throat, a little headache, some massive fatigue sets in to where they're taking naps frequently during the day. Can't really work during their normal day-to-day things that they have to do. And then they progress into the more kind of sick state, as we would say, the fevers, the coughs, and the shortness of breath. Really, it's about the 7 to 10 day mark where people are taking a turn for the worst and then becoming hospitalized. Now, in terms of like what happens at home, I think a lot of people, the majority of people, we're talking about 80% plus, are not requiring hospital admission. And so there's a huge spectrum of clinical disease where some people are entirely asymptomatic, children that maybe have a little bit of diarrhea, maybe one isolated temperature. And then everybody else is kind of in between the spectrum of like headaches without fevers or fulminant symptoms. And then it's the 20% that are hospitalized that we have to watch, take care of, support with oxygen and fluids. And then a much smaller percentage, obviously, that die from this disease. So in terms of the treatments that we have in the hospital, so technically there are no treatments that are 100% effective for the treatment of COVID-19. So we say that it's supportive care alone. So that for us means taking care of the patient, looking at their vital signs, supporting with IV fluids and oxygen. When we do get to a more severe case, somebody that might need a little extra support, then we kind of tap into some more experimental therapies. Dexamethasone is a steroid that we use frequently in the hospital when somebody is dropping their oxygen numbers. I've seen it work really well for a lot of our patients. Another treatment that we have is called remdesivir. It's an antiviral agent, and that doesn't. Right now, there's only about some preliminary information saying that maybe it helps about 33% of the time. And I think just at the bedside, we're seeing some similar numbers. So it's not helping every single person that we give remdesivir to, but some people are turning around with it. And then the last treatment that we have is entirely research-based, and that is giving convalescent plasma. That's a study that we've teamed up with Mayo Clinic in Minnesota for. We take a blood donation from somebody that has recuperated from COVID and has COVID antibodies. We spin it down, we take the liquid portion off that blood, and that's called plasma. And then we transfuse our sick patient with plasma. And again, that's not 100% effective therapy either. We have seen it work really well for some pregnant women that are suffering with COVID. And some more elderly patients, it feels like a good supportive treatment for them. And there is a lot of people that are suffering from GI symptomatology. So they don't necessarily go into that cough and shortness of breath phase of illness, but rather they have severe debilitating diarrhea. So maybe some nausea and vomiting. And so whatever weakness that they already had with the virus is that much more intense because of the vomiting and the diarrhea. I kind of think about this transmission via the asymptomatic person. And I've started to kind of think as every asymptomatic person is a potential future COVID patient. So if I'm sitting and having lunch with my friend and both of us are in an asymptomatic phase, what I think is maybe we are actually in a pre-symptomatic phase, because you might be contagious for about 2 days before you develop any sort of symptoms. And then like just kind of remember what I said before, some of those early symptoms are very mild with just a sore throat and people saying the Saharan sand is blowing through and maybe that's what's going on. And so we have to be very cognizant of what's going on and mask when we're with people, when we can't meet that physical distancing. So there is no magic bullet here for masking being the one thing that's going to save us all. I really think it's layered efforts of prevention, with physical distancing being the main thing. But I also think that the virus is going to be with us for potentially years to come. And I think it's kind of time to learn to live in connectivity with this virus. And the way to do that safely is to physically distance, mask when we cannot, and then wash hands as frequently as possible. I don't know if other questions or...
Thank you, Dr. Greenberg and Dr. Brust from Baylor Scott and White. We also have Dr. Ahmad from Advent Healthcare Systems in Killeen. He is the Chief Medical Officer for Advent, and he's here to provide you an update with the situation from Advent.
Thank you, Judge Blackburn. I would like to first echo pretty much the same sentiments my previous colleagues from Baylor Scott and White has shared. We do have to work on social distancing, hand washing. Dr. Brust was talking about eating together. If we can avoid social distancing while we are eating, that would be helpful. But another way to reduce the transmission, if you're asymptomatic and you have a virus in you, which you probably would never know at the time, is to not face each other and try to have a little angle that will reduce the chance of transmission also. Those are just the handful tips that can help us to get educated how we can reduce the transmission. From our point of view, first I would like to thank our frontline staff members who have been fighting with this COVID. Even when they are sick and they get disease, they are determined in the fight to save the community. I also want to thank our regional partners, both Seton and Baylor Scott and White, for being a good resource. And also we have started working our freestanding ERs so that nobody's working in silos. We are fighting this battle with COVID for the community together. Our state of the hospital, we are following CDC and health department guidelines. We have more than 25% capacity for our patients in general. We have 20% capacity in ICU. We have no shortage of PPE and ventilators at this point. We also are going to continue elective surgeries. As Governor alluded in a couple of his orders, at some point, if we have either challenges with PPE, testing, or our capacity, that's when we'll pull back on elective surgeries, and we are monitoring that on a daily basis. We have a surge plan, like we always had, and one of the surge plan, which Baylor Scott and Seton also has, is to double our ICU in overnight. We can double the ICU within 24 hours with our staffing, and we have the support for that. Last but not the least, I do want to re-emphasize the help we need from the community. Community is our best support, and community is going to help us to gear and flatten this curve. So if you can help us to send the message and help us educate the community, even when you go out for shopping and you're using the card, make sure you wear the mask and wash your hands before and after. Don't touch your face. Don't touch the front of this thing. Use from the ear loops. Don't touch it. This is the dirty side. This is the safe side. So please wash those small things, and that will help us to mitigate this virus and the spread of this. And that's all from me. I would be happy to take any questions. Thank you.
Thank you, Dr. Ahmad. And finally, we have Chief Nurse from Seton Medical Center, Harker Heights, Ms. Travis. Ms. Travis is going to provide you an update and overview of the current status of the operations at Seton. Ms. Travis.
Good afternoon. We're certainly seeing the same trends that my colleagues have mentioned. Definite upward trending in our COVID testing and definite trending up in our positive results. We continue to restrict our visitations to the hospital, except in unique situations involving end of life or new babies. We've done now close to 2,000 tests and have had over right at 100 positive cases. And interestingly enough, probably over a third of those have been in the last 24 to 48 hours. We're testing lots of patients in that we do our pre-op screening because we are doing surgeries at the hospital, and we screen all those patients for any COVID symptoms or positive tests. We now have about pretty much 99% of all of our staff back working full-time, and our ED has recovered back up to about 75% of its previous volume. All of our staff is daily. We monitor our staff when they come in for temperature. We take their temperatures, we do a COVID screening, and we do that every morning. And on our elective surgery schedules, we go over those every morning and afternoon to make sure that we're maintaining a certain bed capacity so that we have room for our COVID patients. We too have surge plans in place for increasing our bed capacity in ICU and our med surge. And we're getting probably over about 75% on our med surge capacity, and our ICU is holding its own. We have plenty of PPE, and things are rocking along really well. So I agree. The best thing we can do is, as a community, is make sure that we're wearing our masks. I see a lot of people who just don't want to wear their masks, and I can understand that, but that is one of the best things that we can do to help prevent the spread of this virus. So, thank you.
Thank you, Ms. Travis. I also have some information I'd like to share, and then I'll again open it up for general questions for anyone who's present, anyone you'd like to direct it to. I also invited Temple VA Hospital to the press conference today, see if they had any information they'd like to share. They extended their regrets not being able to be here, but their team is involved in a meeting right now relating to COVID that required the presence of the individuals that would otherwise be here. But they did send some information to me that they advised I could share. They have Temple VA has 90 total beds. Those beds break down into 68 med surge, 17 are now designated as a COVID unit, and 5 ICU. The number of beds they currently have available are 28. 20 of those are in the med surge and 8 in the ICU total. They have currently 12 COVID-19 patients that are occupying that 17-unit COVID unit, and they advise that all of the COVID unit beds are maintained at ICU level standards. They also advise that they have been sending staff from Temple VA, both inside the state of Texas to other VA facilities to assist those facilities that are having staffing issues, as well as staff outside the state of Texas. They have also been receiving patients from outside of our service area into the Temple VA because of capacity issues at other locations. And again, that information is from the Temple VA hospital. That's all I have today. Unless there's any questions for me or for any of the guests here, I'd be happy to try to address those.
Hi, this is Andrew Moore with Channel 6 News.
Yes, sir. Hi, Andrew.
All right. Thank you for the time today. We were wondering, with Governor Abbott signing the executive order on the second prohibiting gatherings of 10 or more, or plus a mayor or county judge approve it, is there something the county or local cities are now going to have to enforce as we have more and more of these protests?
From the county perspective, we're doing or following the same measures, enforcement measures that we followed in previous governor's orders, which are if the complaint is received, we identify the appropriate state law enforcement agency and or state licensing agency. So for example, a complaint received at a restaurant would be handed over to the Texas Alcoholic Beverage Commission if that restaurant has a TABC license. So that's the enforcement measures that we're taking. In terms of gatherings, my office has an application permit for any outdoor gathering that is 10 or more. I've handled probably maybe about a dozen of those applications since the governor's order. And those are processed fairly quickly. It's a one-page application. The application criteria follows the same guidelines that the governor's office has set forth, or I'm sorry, that DSHS has set forth on their COVID protocols. So if you go to their website, you'll see a long list of health protocols for things like weddings and restaurants and bowling and all kinds of establishments. The one that our permit is modeled after is the one relating to outdoor gatherings. But that's how we're handling that at this time.
Or if there are these big protests like the one in Belton 2 weeks ago, how would that be handled by law enforcement if that was something that was not approved ahead of time?
Well, again, outdoor gatherings go either to the mayor or to me, depending upon the location of those gatherings. And so that gathering was in Belton. So that gathering would have required a permit or an application or approval from the mayor of Belton.
Okay, if something happens in the county and they don't have a permit, how do you respond? Like, is there a warning given to them?
We respond just the way I said a moment ago. We notify the appropriate state law enforcement agency or state licensing agency and let them take whatever action they deem appropriate.
Okay, thank you.
Any other questions? Last call.
Well, you know what, this is Andrew again. I did have a question, I guess, for
Question for who?
the health district.
Okay.
Yes, sir.
We were wondering what the positivity rate is over the last 7 days.
I don't have it calculated for the last 7 days, but we have the total positivity rate on the dashboard. If you send me an email, I'll calculate it for the most recent 7 days and I can send it to you.
Okay, and is there an idea of how many patients across all hospitals are hospitalized right now?
That is on the Trauma Service Area L dashboard for the state dashboard. That's the entire region. And they have that updated every day on the DSHS dashboard.
Okay, so that's the same number then.
Just remember Trauma Service Area L.
The only other question I had was how close to, in other counties, the governor has banned elective surgeries. Do we think that's going to be something that's going to happen here soon?
I think our healthcare providers have addressed that. That's not something that is up to me, but I think they've addressed that in their previous statements.
Okay.
Thank you, sir.
Hey, Dr. Robinson Chadwell.
Yes.
Hi, it's Hunter King with the Clean County Herald. I just had one quick question for you.
Yeah.
Do you know how many positive cases have come out of the Friends in Crisis homeless shelter during Clean?
I'm trying to think of the number. I don't have the number off the top of my head. I wasn't expecting that question, but shoot me an email, Hunter. You have my email, and I will pull that off of our log and let you know.
Will do, thanks.
All right. Thank you, sir.
I'll ask Dr. Greenberg with Baylor Scott and White to come up and address the question about the elective surgeries and the governor's orders. I think as of right now, there are 8 counties in the state, the 4 largest counties in the state, as well as 4 counties in the valley, as I recall, that are subject to that order in terms of restricting elective surgeries. But I'll let Dr. Greenberg address that question from Baylor Scott and White standpoint.
Hi, this is Bobby Greenberg again, CMO of Emergency Services. Obviously, we can't answer for what the governor would do. Our answer from Baylor Scott and White Health, and I hope I speak for the other facilities here, is that we are doing our best to self-monitor and self-manage our volumes so that we can take care of our community, take care of the patients that are here, and at the same time, provide some level of elective care. We have a lot of flexibility in how we can do that. There is a big downside to completely cutting off elective care, I think, as everyone knows. So it is a balance. There's not a way to give a single answer. I can tell you that today we are looking at our elective procedures to see if we will continue them next week or not. We have not made a decision. Those are decisions that are going to be made based upon the volumes that come to us. We don't know right now where we're at on the curve. Most of us are concerned that we're just starting out on what's going to be a big surge, but it could level off. So we are just, the answer I have is we're constantly monitoring our resources to take care of our community. Is there anything else, sir? I don't hear it.
Thank you, Dr. Greenberg. I was also just advised, and I haven't seen the list, but apparently the governor added multiple counties today to that list of counties that are restricted from elective surgeries. So again, I haven't seen that list, but I'm sure all of you have access to the same portal that I do at the governor's office to see the list. But apparently there were 20-something counties apparently added to that list. Any other questions? All right, thank you very much.